Hi, my name is Zayan Liu, and I am an assistant professor at Montclair State University. I'm excited to share with you some of my current research looking at structural sexism and children's health. Specifically, today I will be presenting preliminary data from a study entitled Spillover Effects of Structural Sexism on Children's Health Insurance Status. As many of you know, structural sexism in the US is associated with adverse population health outcomes among women. However, today, no study has examined whether structural sexism also have spillover effects on children's health status in the US. We know that policies that are implemented by male politicians differ quite substantially from policies that are often supported by female politicians. In addition, we also know that a large proportion of children in the US have health insurance access through public health insurance programs. Therefore, it's plausible that structural sexism, as measured by female state political representation, might in fact have an effect on children's health insurance status. To examine this question, I merged data from the 2018 to 2019 National Survey of Children's Health with the 2016 percentage of state-specific female legislatures. I specifically chose the 2016 percentage of state-specific female legislatures to allow for the lagged effect of any policy change that would potentially affect children. For the exposure structural sexism, I created tertiles based on the state's female political representation. For the outcome, I looked at two different indicators of children's health insurance status. The first one was based on a question asked by NSCH, which state asked whether or not the child was currently insured. The second indicator asked whether or not the child experienced a health insurance gap in the past 12 months. For the methods, I conducted a series of multi-level logistic regression models. In the fully adjusted models, I included individual level confounders such as age, gender, household income, and race and ethnicity. I also included state level potential confounders, including the population percentage in poverty in the state, as well as the state population size. All models were survey weighted and included clusters, taking into account how NSCH was collected. In the unadjusted models and in the fully adjusted models, I find that children living in states with the lowest female political representation compared to their peers in states with the highest female representation had higher odds of being uninsured, as well as had higher odds of having an insurance gap. However, in the fully adjusted models, these higher odds ratio was not statistically significant at the 0.05 level. I conduct a further analysis to see whether or not household income was an effect measure modifier. And I found that the associations did vary by both outcome and household income. The interaction terms for household income and the state political female representation was statistically significant. For that reason, I am presenting the stratify analysis based on the household income. As you can see in the figure in my poster, for the currently uninsured outcome, I found higher odds ratios for the households that were 100 to 199%, and among the households that were 400% above federal poverty level. For the outcome, having experienced a recent insurance gap, I found that there is a higher odds ratio for insurance gap among those with a low household income strata. So for the insurance gap, we really see a trend where when we conducted stratify analysis, you find a higher association among those who were in lower income households. So what these results suggest is that these variations in the association by the outcome and by household income might indicate differences in policy mechanisms by which structural sexism is affecting children's health insurance status. I plan to conduct further research examining these possible policy mechanisms that may serve as potential mediators, such as whether or not there were changes in Medicaid coverage or changes in Medicaid criteria, as well as an expansion in Affordable Care Act that may be the policy mediators that is responsible for the associations that we see in the stratified analysis. So thank you for your time, and please feel comfortable contacting me by email if you have any further questions or comments. My email is lius@montclair.edu. Thanks again.